Body dysmorphic disorder. The best treatment options. Body dysmorphic disorder, BDD, is a mental illness characterized by a preoccupation with minor or imaginary physical flaws, usually of the skin, hair, and nose. The cause of body dysmorphic disorder is not well understood. Symptoms include excessive anxiety and stress about the perceived defect that can lead to compulsive behaviors. Examples include excessively grooming, seeking reassurance from others about the perceived flaw, excessively checking the mirror, and hiding the imperfection. People with body dysmorphic disorder are more likely than others to undergo cosmetic surgery. Treatment can include psychotherapy in the form of cognitive behavioral therapy, as well as medications. Body dysmorphic disorder, BDD, is a serious illness in which a person is preoccupied with minor or imaginary physical flaws, usually of the skin, hair, and nose. A person with BDD tends to have cosmetic surgery, and even if the surgery is successful, does not think it was and is unhappy with the outcome. Symptoms of BDD: camouflaging, with body position, clothing, makeup, hair, hats, etc. Comparing body part to others' appearance. Seeking surgery. Checking in a mirror. Avoiding mirrors. Skin picking. Excessive grooming. Excessive exercise. Changing clothes excessively. Being preoccupied with minor or imaginary physical flaws, usually of the skin, hair, and nose, such as acne, scarring, facial lines, marks, pale skin, thinning hair, excessive body hair, large nose, or crooked nose. Having a lot of anxiety and stress about the perceived flaw and spending a lot of time focusing on it, such as frequently picking at skin, excessively checking appearance in a mirror, hiding the imperfection, comparing appearance with others, excessively grooming, seeking reassurance from others about how they look, and getting cosmetic surgery. Getting cosmetic surgery can make BDD worse. They are often not happy with the outcome of the surgery. If they are, they may start to focus attention on another body area and become preoccupied trying to fix the new defect. In this case, some patients with BDD become angry at the surgeon for making their appearance worse and may even become violent towards the surgeon. Treatment for BDD. Cognitive behavioral therapy. This is a type of therapy with several steps. The therapist asks the patient to enter social situations without covering up her defect. The therapist helps the patient stop doing the compulsive behaviors to check the defect or cover it up. This may include removing mirrors, covering skin areas that the patient picks, or not using makeup. The therapist helps the patient change their false beliefs about their appearance. Antidepressant medications, including selective serotonin reuptake inhibitors, SSRIs, can help relieve the obsessive and compulsive symptoms of BDD. Treatment is tailored to each patient, so it is important to talk with a doctor to determine the best individual approach. Many doctors recommend using a combination of treatments for best results. The primary goal of mindfulness-based CBT is to learn to non-judgmentally accept uncomfortable psychological experiences. From a mindfulness perspective, much of our psychological distress is the result of trying to control and eliminate the discomfort of unwanted thoughts, feelings, sensations, and urges. In other words, our discomfort is not the problem, our attempt to control and eliminate our discomfort is the problem. For an individual with body dysmorphic disorder, the ultimate goal of mindfulness is to develop the ability to more willingly experience their uncomfortable thoughts, feelings, sensations, and urges, without responding with compulsions, avoidance behaviors, reassurance seeking, and/or mental rituals. To learn more about mindfulness-based CBT for the treatment of BDD. Individual therapy for the treatment of body dysmorphic disorder. Low-fee group therapy for the treatment of body dysmorphic disorder. Telephone and online therapy for the treatment of body dysmorphic disorder. Intensive BDD treatment. Selective serotonin reuptake inhibitors, SSRIs. SSRIs are a type of antidepressant that increase the levels of a chemical called serotonin in your brain. Serotonin is a chemical that the brain uses to transmit information from one brain cell to another. A number of different SSRIs are available, but most people with BDD will be prescribed a course of fluoxetine. Mind reading. In addition to holding negative thoughts about themselves, people with BDD assume that others view them negatively. With this technique, patients learn that these assumptions aren't rational. Mindfulness, metacognitive therapy. From a metacognitive perspective, the important thing is to learn to accept the presence of distorted thoughts and uncomfortable feelings without over-responding to them with avoidant and compulsive behaviors. Exposure and response prevention. BDD and obsessive-compulsive disorder, OCD, have distinct similarities. Patients who have BDD or OCD typically engage in ritualistic behaviors to avoid anxiety.